Hey, Dr. Shoshana here. Ready? Hey, Dr. Shoshana here. I'm here with Louise, a new patient. Came in from Postural, Long Island, so not that far. The reason I decided to document you is because you're an uncomplicated case. Usually I see people in bad shape.
Yeah.
22-year-old guy, pretty healthy, but you told me is had a fall 5 years ago?
5 years ago, about, yeah.
And ever since then, your back hasn't been right. You have full range of motion, but you said your neck, you have trouble turning right.
Yeah.
So we looked at your posture. I know the camera, I'm going to point some of this stuff out. So what we do is we look at everyone. The green line is the center of gravity, and red is where you are. So you're kind of listed to the right. And you were saying in your history that you always feel like you have to lean one way. Which way you said you always?
I always have to lean towards my right side.
Okay, so you're a great candidate for it. We're going to jump right into the full spine adjustment. So let's go face down.
Beautiful.
Let me just wipe this down. I wipe it down with some material before. Let's go face down. Usually during our day operations, when we're not documenting the video, we put face paper, but here for sounds, we want to avoid the face paper. Okay, so relax your feet here. Good. So the left side is a little short compared to the right. And then I'm going to have you lift your right leg as high as you can. That looks good. Put it down. Now the opposite side. Put it down. Difference, or do you notice a difference?
Yeah, I feel like I can lift the right side.
Let's do that again so the camera can pick that up. So what I'm doing is I'm holding the sacrum. I'm not putting pressure this way or pressure that way. Lift that right leg straight up. A lot easy. That's how it should be. Put it down. Left leg straight up. You can see it's a lot more effort.
Yeah.
Right? So that left SI joint and even that sacrum is an issue. So we're going to jump right into the drop technique. Okay, take a deep breath in and let it out. Good. Breathe in and out. Good. Breathe in and out. Good. And now I'm going to jump into the sacrum. So pick this leg up, cross it over, like kind of like, yeah, put it down. And we're going to go in for sacral rotation. Take a breath in and let it out. Good. Breathe in and out. One more. Out. Good. Uncross that now. Let's see that right leg. The left leg, I'm sorry. Different.
Oh, yeah.
Put it down. The camera can pick that up. Do that left leg again. Yeah, a lot easier, a lot less recruitment. And we're going to come to the leg check. Wow, that's pretty obvious. That left leg is a lot longer. All right, so now we're going to jump into that full spine adjustment here. So in exam, we found that his transitional segments were really locked up. Okay, take a nice deep breath in. When I tell you to, I want you to kind of bring your heels to your butt, okay?
Okay.
Breathe in, and let your air all the way out. Bring your heels to your butt. Boom. Good. Put them down, good. So I don't know if you noticed, but my line of drive was really inferior to superior. So I'm gonna jump right back in. Good. Breathe in, and I want your air out, down. Nothing moving there. You're stuck, stuck, stuck. Drop these arms down, there we go. Breathe in, I'm just gonna rotate away. There we go. And air out, down. Clunk, clunk. Flip over for me. This side. Good. Doing here is just getting the knee, pelvis, lower back moving well. There we go. Okay, good. Now sit up. Swing your body around this way. You don't sit in this middle cushion, it's a little more level. And then we're gonna jump right into the rig dinger after this, but I want you to tell me what you notice differently when you get up, okay?
Okay.
Good. Elbow. Good. Stand up for me.
My back feels a lot, like, less tight.
There we go. All right, now I'm gonna unload your entire spine. So butt goes here, neck goes here. Lay on your back. Okay, so you've seen the videos, you know what, kind of have an idea of what's coming. Slide down towards your feet. Okay, good. So yeah, we had a lady come in from Connecticut yesterday. Today you're coming from Patchogue, which is a good couple-hour drive into Manhattan. Raise your hands a little higher. But I tell everyone, this is not a one and done treatment.
Yeah.
It is a series of 6 visits. The doctors that developed the technique, slide down, Dr. Gregory Johnson in Houston, Texas, sees people twice a day, 3 days in a row. Breathe in. And let it out. Okay, good. So we're in there nice and snug, yes?
Yep.
All right. So keep your hands crossed like that. Keep your mouth closed. Keep your tongue in your mouth. And when I tell you to wiggle your toes, let me see you wiggle your toes. Just like that. Okay, good. All right, so there we go. Get the ideal height for me. Good. Take a deep breath in and let it out. Good. Breathe in again. And let it out. And wiggle those toes. Wiggle them. Okay. Are you okay with that?
Yeah.
Good. When I did that pull, where did you feel it?
I felt it like mid to lower back.
Mid to lower back.
Yeah.
Okay. All right, now we need the rest of your cervical. Jump into some instrument work. Drop this hand. And we go. Wiggle those toes. And a little more. Nothing left. Hey, your neck is really a big part of it.
Yeah, for sure. I feel like I always need to constantly be like
Cracking your neck.
Yeah.
What you'll find is that generally tells me that something lower in your spine isn't moving as good. So as we progress through care, that should get easier. You should find that you don't need to pop your neck as often. Turn facing me, and then sit up straight, sit up, and then stand up. Facing the palms, take your arms like this, bring your head really back. Maintain this position, squeeze, head back. This doesn't hurt at all. There's an instrument-based adjustment. Sometimes we use this on TMJ. For people that have TMJ dysfunction, sometimes we use it. And I use it on most patients after the ring dinger. Now try walking down and then tell me what's different than when you walked in.
Oh yeah. Like in the center now.
In the center.
Yeah.
Right, so we put your body in a better alignment, dealing with gravity. And then as we progress through care, you'll learn this new position, you'll stay that way. So again, Rome wasn't built in one day. We like to ask for at least a handful of visits to really modify, get you going, all right?
Cool.
Cool, perfect.